Hi everyone, and welcome to our YouTube channel. In today's video, we will discuss about endometriosis. Endometriosis is a prevalent health issue in women where cells from the uterine lining grow outside the uterus, often affecting the pelvic cavity, ovaries, fallopian tubes, and tissues supporting the uterus. It can also affect the vagina, cervix, vulva, bowel, bladder, or rectum, and in rare cases, other body parts like the lungs, brain, and skin. When it occurs within the uterus muscle, it is called adenomyosis. Endometriosis may be hereditary, with a higher likelihood if you started menstruation early, never had children, or have frequent or prolonged periods. The condition can cause significant pain, disrupting school, work, social activities, and relationships, and can lead to infertility. Diagnosis is crucial for managing symptoms, with treatments including pain relief medications and surgery to improve fertility. Now let's discuss that. Why does endometriosis cause pain and other problems? Each month during the menstrual cycle, the ovaries produce sex hormones that build up the lining of the uterus with tissue and blood vessel, such that the lining of the womb swells and become thicker. If a woman does not get pregnant during that cycle, the uterus sheds this tissue and blood. It comes out of the body through the vagina as her menstrual period, or quite often flows back into the pelvis through the fallopian tube. The endometriosis tissues behave exactly like that of the normal lining of the womb, in that it responds to the sex hormones and become built up with swollen and thicker tissue and blood vessels during the menstrual cycle. However, unlike the endometrial cells found in the uterus, the tissue implants outside the uterus are unable to freely release menstrual bleeding, so they stay in place, trapped and under tension during the period. This happens again at the next period, and it is this repeated process that leads to pain and other symptoms of endometriosis. Tissue and blood that is leaked into the body also can cause inflammation, scar tissue, and pain. As endometrial tissue grows, it can cover or grow into the ovaries and block the fallopian tubes. Endometriosis in the ovaries can form cysts called endometrioma or endometriotic cyst. It also can cause inflammation and cause the body to form scar tissue and adhesions, tissue that sometimes binds organs together. Let's talk about what causes endometriosis. The cause of endometriosis is unknown, but experts have a number of theories. One theory is that the endometrial cells shed when the menstrual flow travel backwards through the fallopian tube into the pelvis, where they implant and grow. This is called retrograde menstruation. This backward menstrual flow occurs in many women, but experts think the immune system may be different or faulty in women with endometriosis. If a woman has a faulty immune system, it will fail to find and destroy endometrial tissue growing outside of the uterus. Second theory is that since endometriosis runs in families, it may be passed on in the genes, or some families have traits that make them more likely to get it. Third theory is that new research shows a link between dioxin exposure and getting endometriosis. Do you know what the symptoms of endometriosis are? The most common symptom of endometriosis is pain in the lower abdomen or pelvis, or the lower back, mainly during menstrual period. The amount of pain a woman feels does not depend on how much endometriosis she has. Some women have no pain, even though their disease affects large areas. Other women with endometriosis have severe pain, even though they have only a few small growths. The lower abdominal pains occurs as cramps, and may start for about a week before menstruation, but gets worse as the period starts and continues throughout the period. Other symptoms of endometriosis can include pain during or after sex, painful bowel movements or painful urination during menstrual period, spotting or bleeding between menstrual period, diarrhea, constipation, bloating, or nausea, especially during menstrual period. Now let's discuss that. How is endometriosis diagnosed? The information you provide to your doctor or gynecologist about your menstrual period and the nature of the pelvic pain that you have will help your doctor to suspect that you may be suffering from endometriosis. An abdominal and vaginal examination may reveal that you are generally tender in both areas. A painful swelling may be felt. If you have developed cyst of the ovary from the endometriosis, occasionally cysts will be felt on both ovaries. The examination may also reveal the presence of a firm nodule from the scarring of endometriosis. Tests that are done to help diagnose endometriosis include pelvic ultrasound and transvaginal ultrasound. If your doctor thinks you might have endometriosis, they may start you on treatments like contraceptive pills. However, to be sure, they'll likely recommend a laparoscopy to confirm the diagnosis. This is an operation to pass telescopic camera through your belly button to have a view of the internal organs on the pelvis. Magnetic resonance imaging, or MRI, is another common imaging test that can produce a picture of the inside of your body. This is increasingly showing features of endometriosis quite accurately. In cases where a laparoscopy may be considered as dangerous or unadvisable, an MRI may be considered first. When laparoscopy is done, if your gynecologist is experienced in this area, a small sample of the endometriosis may be removed for testing laparoscopic biopsy of endometriotic deposit. Now, the important thing is, how do we treat endometriosis? Treatment for endometriosis varies based on factors such as age, symptom severity, disease extent, and fertility plans. While there's no permanent cure, symptoms can be effectively managed. First one is pain medication. Pain relief often begins with over-the-counter medications like ibuprofen or acetaminophen during menstrual periods. Regular checkups every 6-12 months are advised to monitor disease progression, especially if painkillers are the primary treatment and pregnancy is desired. Second one is hormonal treatment. Hormonal treatments are often recommended for managing endometriosis when simple. Painkillers are ineffective or to prevent disease progression. First hormonal therapy is combined contraceptive pills. These contain estrogen and progesterone to prevent ovulation and reduce menstrual flow. Continuous use for 3 cycles without a break can help shrink endometriosis tissue. Second is progestogens. Progesterone-based hormones work against estrogen effects on endometrial tissue. Medroxyprogesterone injections, which also suppress menstruation, are commonly used despite side effects like weight gain and mood changes. Third is Mirena intrauterine system, contains levonorgestrel, and is increasingly used for both contraception and endometriosis treatment, offering localized hormonal effects. Newer medications, it includes leuprorelin, triptorelin, relugolix, and dienogest. Third treatment option is surgery. Surgery is often the preferred treatment for severe endometriosis in women experiencing widespread pelvic deposits, severe lower abdominal pain impacting daily life, and fertility issues. There are several surgical options available. First is laparoscopy, used for diagnosis and treatment. This minimally invasive procedure removes or burns away endometriosis implants and scar tissue. Second is laparotomy. In more complex cases, a larger abdominal incision may be necessary to access and remove extensive endometriosis growths in the pelvis or abdomen. Third is removal of both ovaries. This option involves removing both ovaries and usually the uterus. Hysterectomy to prevent endometriosis from returning. It's considered when the condition has severely damaged these organs. Please like the video, subscribe to the channel, and share it with others to spread awareness about different aspects of endometriosis.